Welcome to the Men's Health Unscripted podcast with Patrick and Cam.
Where we focus on your entire health, mental, physical, spiritual, and emotional to make sure you are good to go every day.
Welcome to Men's Health Unscripted, your favorite show, talking about erectile dysfunction today, which I think all men care about more than maybe anything in the world. So we're here with Jeff Nuziard. He has the only globally patented cure for erectile dysfunction, and that is called RegenMax. So, Jeff, thank you so much for coming on the show. I am excited to talk to you about this today.
Well, thank you for having me. I'm excited to talk about it. It's been a lot of years of research and development. I've been living with this thing for 20 years now, and so I'm excited to talk about it.
Awesome. So, wait, you've been living with RegenMax for 20 years?
I started the research and development when I turned 40 years old, and I'm 59. So,
Yeah. All right. So, tell us a little bit about RegenMax. Like, we're going to ask you some questions. How did you, what inspired you to, help cure ED other than like, most guys, they don't really realize there's a problem with health until ED starts to pop up, or, they don't realize mental health is a
well,
problem until ED pops up.
I turned 40 years old, and I had just gone through a divorce, a 17-year marriage divorce, and I thought maybe I'm having problems with that and with a divorce and new people, whatever. But no, I was definitely struggling with ED, and it was like it happened overnight, but it wasn't. It was a slower process than that, but it really felt like it happened overnight. And so, out of necessity and survival, I just started digging into research, and I started with hormones, and just one thing led me to another. To literally, I was in a lab and I'm doing research on cadavers and pigs and you name it. I'm trying to figure out the anatomy and figure out why. I knew there was a cause, and everybody's been chasing blood flow as the cause for ED for decades, and that is not the cause of erectile dysfunction. It's a result of erectile dysfunction, but it's not a cause of it. So once I was able to get down to the nitty gritty, so to speak, and find out the cause, I knew what I had to do to fix it. I just didn't know how to do it, didn't have the right equipment, didn't have the right machines and things like that. So I kind of had to wait as technology was developing in the medical device world. And fast forward, here we are. I took 15 years to actually develop it and come up with this cure. And it is a cure, and I'm really glad you said that. It's RegenMax is a cure for erectile dysfunction. It's not a weekend warrior. It's not a pill. It's not surgery. It's a series of treatments that literally rebuilds all the tissue inside a penis, takes you back to like 25 years old.
What type of treatments are this? I mean, we've on this podcast, I think we've explored almost everything to do with ED. Is it sound wave technology? Is it what's the word I'm looking for? Invasive? Is it a cream?
Small molecules.
Yeah.
Yeah, it's very non-invasive actually, other than you're laying there with no pants on when you're getting treatment. So if that's invasive, then I guess we call it invasive, but it's really not. It's a series, there's four pillars. And to explain how RegenMax works, I mean, the reason why we got a patent is we had proven a 97.2% success rate on a 250 patient clinical study. Since that study, we've had 3,000 men go through the program, and we're still holding on to that 97.2%. It's fluctuated between 97.2 and 97.6, but we're still holding on to that. So we're pretty happy with that. But going back to why ED actually happens, the best way to explain it is for you to think of your body like an electrical panel at home. It's very common knowledge that we stop producing testosterone by about 2% a year, starting somewhere in our 20s. So if you're 55 years old, and just for easy math, say you started at 25, now 55, there's 30 years, 60% of your testosterone production is gone. And no matter what these pill companies and supplement companies tell you, once your testosterone production is gone, it doesn't come back. It's gone. So the problem with that is when your testosterone's lowering and going down every year, when it hits a magic number that's unique for you, it opens the door to that electric panel. And it starts turning breakers off one at a time until the last breaker's turned off and we expire. That's called the aging process. So point number one is we don't age and then lose testosterone. We lose testosterone and that activates the aging process. That triggers everything. The first breaker that gets turned off happens to both men and women is our production of collagen. And women notice it way before men do because they look in the mirror every day and put makeup on and they pay attention to things that we don't give a rip about. And they see that line that all of a sudden wasn't there a week ago or a wrinkle that they didn't have and now they do. And this is why we have women flocking to med spas for Botox and fillers and all that stuff at so young because they see it. Men, we don't see it, nor do we care about the line or whatever in our face. But what's going on is inside the penis are two tubes called the corpus cavernosum. It's a spongy tissue that's designed to, the blood pours in and the sponge expands, absorbs all that blood until it activates two muscles in the back of the penis that lock the blood in. Now, that's how it's supposed to work. But when our collagen starts breaking down, those sponges are held together, and the integrity and the flexibility and the absorption of those sponges all determined by your collagen. So if you have collagen not feeding and protecting that sponge, the sponge begins to degrade. It's just like an old kitchen sponge at home on the sink. When you bought that sponge and opened the package, it was double the size. It absorbed everything. And over time, it shrinks up and it becomes unusable. It becomes stiff and it doesn't absorb anymore. Atrophy sets in. Well, that's exactly what happens with the male anatomy. Atrophy sets in the sponge. So what I will tell you is the first symptom of erectile dysfunction is I can get erect, but I can't keep it erect. That's the problem. It's because your sponge didn't absorb enough to activate those two muscles in the back to clamp down on the erection to where it holds the blood in. That's called the venous leak. So that's the cause of erectile dysfunction is your sponge is going bad. And it goes bad over time. For me, at 27, I know for a fact my testosterone was 1185. I know for a fact. At 40, it was 305. So my testosterone levels dropped very quickly. Didn't start till my later in my 20s, but then was dropping way more than 2% a year. So the sponge was degrading for probably 7 to 10 years of that time. And then I just happened to notice it. We don't notice it because we get an erection, we're having sex, everything's great. We don't realize it's about 95% there. And that's not enough to make those muscles lock in, but we're young and healthy and blood keeps pumping in. So it kind of masks it over. To prove this point, the drugs, the Cialis and the PD5 drugs that they call them, Cialis, Viagra, Levitra, those types of things, they work until they don't. And it's not that we get resistant to those drugs. It's that the sponge is not absorbing all the blood that's sending in. They dilate the vascularity for sure. And so blood keeps pumping in. I got guys come in all the time that say, yeah, I was on Cialis for the last 2 years and worked great. And now it doesn't work at all. And sometimes I take two and it still don't work. Well, do you get firm when you do that? Yeah, it gets firmer, but it's not penetrable. It's not close to an erection. It's because you've got blood flowing in, but the sponge is not absorbing it. It's flowing right back out again. The sponge is bad. The muscles aren't flexed to trigger that. They get atrophy. So then your body is very good at overcompensating for injuries and other problems. So your body says, well, you're not absorbing all the blood we're sending in. So the veins begin to get atrophic and shrink up to send less blood volume in. So now you get about a 75% erection and can't keep it. You get about a 50% and can't keep it. And it just snowballs downhill from there. So, with all that in mind, what do we got to do to fix it? RegenMax is a four-pillar process. Number one, we have to do angiogenesis, which is create new blood vessels to replace those atrophic ones. That's where the acoustic shock wave comes in that you've heard about, Gaines wave, things like that. There's many different ones. We have our own protocol that's different than anybody's, and we get very good success with it. But that by itself is not going to fix the problem. Not going to fix the problem. So it's going to create new blood vessels, but if you don't get the sponge right and fixed, you're just going to have the same problem. You're going to have blood blowing in and going right back out. So we have to regenerate the new sponge tissue. Shockwave will do that, but it won't remodel the collagen. It won't get the collagen right again. But what it does do is it creates micro tears in the sponge and it creates new veins. And those micro tears in the sponge is like lifting weights. You lift weights, your muscles break down, your body rebuilds them bigger, better, stronger, faster. Same thing is true with the penile tissue. Then we have a very specific laser and just new to the market, a radio frequency device that are brand new. The radio frequency is anyway, that penetrates deep. There's only, you got to get, this laser comes out of Europe and it's expensive, but it goes deep enough into the tissue to where it remodels the collagen, but it doesn't hurt the skin on top at all. You don't even feel it. It feels like a heating pad. There's no pain at all. And it gets the sponge hot enough inside to where it remodels that collagen. So we can remodel the collagen in the sponge, create new blood vessels, and create new smooth muscle cells that wrap all that sponge up. But if we don't get your hormones balanced, two steps forward, one step backwards. You're just going to degenerate right back to where it was at. So we have to get that balanced. Then the fourth pillar of RegenMax is the second breaker that gets turned off in our electrical system is our production of stem cells. People think the P shot and the O shot are great because we draw our blood, we spin it, platelet-rich plasma, inject that back in. In my case, I'm 59 years old. That means my exosomes and stem cells in that blood, in those platelets, are 60-year-old stem cells. That's not very regenerative. Those are old and degrading. So I developed a fluid called tissue regenerative fluid. And it's very unique to us. I mean, it's part of the patent, but it's a stem cell replacement that makes all this regeneration happen in weeks, not months or years. If you use your current stem cells or your current exosomes in your body, it will take a lot longer for that healing process and a restorative process to happen. I mean, think back, and when you're 25 years old, you can go work all day, party all night, go work out, get up and do it again the next day. No problem, because we recovered quickly. The older we get, that doesn't happen very often. So it's a four-pillar process. We got the shockwave, the heat device, optimizing your hormones and getting them right, and then the tissue regenerative fluid to make all this happen at a quick pace. That fluid stays right there because of the injuries that we're putting into the tissue. It stays right there and regenerates extremely fast, extremely fast. So again, we have a 97% success rate because we're dealing with the overall problem. All four areas have to be dealt with, or it's just going to be like a med spa and you just get a treatment here and a treatment there and call it a day, and it doesn't work. It just doesn't work. Gaines wave by itself doesn't work.
So, quick question about the regenerative fluid. If it's essentially younger stem cells, where is that coming from? Like, what source are you guys using to get that? Because there's a lot of concern and a lot of misinformation about stem cells and things like that kind of floats around.
Great question. Really glad you asked that. So we get first of all, we don't use stem cells. We use the exosomes that are extracted from the stem cells. And exosomes are very highly concentrated growth factors that are important. When a baby is born, the placenta has two layers to it, the chorion layer and the amnion layer. So I was able to develop a fluid that we extracted the stem cells from the chorion layer. The reason why that's important is the chorion layer is responsible for building the tissue in the baby. That's all those stem cells in that are the generative ones. Then the stem cells in the amnion layer are more health and well-being. So what I decided was we'll take the chorion layer exosomes from 1 day old live birth placenta. Um, that's a common trade every day, bought and paid for. No aborted babies here, just live birth placenta. It's been sterilized 6 times, and those exosomes are extracted from there. And then we put that in the amniotic fluid, which has about 3 billion exosomes in it by itself. So we have 50 billion chorion layer and 3 billion amnion layer. And then we have type 1, type 3 collagen. We have some hyaluronic acid, some other highly concentrated growth factors that go in that fluid. Mixed, sterilized. There's zero contraindications for them. As a matter of fact, right now I've got a couple pulmonologists test driving it for us right now, doing a clinical study, and are regenerating lung tissue for COPD patients. It's so regenerative. They're using a nebulizer and breathing it in. It's very, very regenerative. And so that's why we're able to do it.
Man, that's really interesting stuff, especially with the COPD. Now, another question that's kind of popped up, you know, in this discussion is like, what's your downtime look like? I come
No
in to
downtime.
see Jeff.
No downtime. Great question. We want you to use that penis as much as possible. It's a muscle. The more you use it, the better results you're going to have. What's frustrating is I got men that come in and say, "Well, I want to get my ED fixed because I'm thinking about going out and start dating again or whatever." It's like, well, wait a minute, you got to use it. You can't just be sitting around going, "Well, I'm going to be 16 again." It doesn't work like that. Number one, we are aging, and there's other factors. The ED part can be fixed for sure. There's other factors. There's emotional factors, mental factors. There's things like that that got to be right as well. But there is no downtime to this procedure. You come into my office, we treat you. It's a series of treatments, and to buy RegenMax, you're committing to a year long, basically putting your penis back in the gym for a year. And when you're done, and it doesn't take a year for you to be fixed, so to speak, but when the year is up, your penis will be like 25 years old again. You have no issues at all, and you'll be good to go. And people say, well, how long is that going to last? We're aging. Once that aging process starts, you can't stop it. So we have maintenance programs, but if you, let me just put it this way, we've had a lot of different patients come in and out of this, and we have some patients that buy the maintenance. We have some patients we never see again. If you do nothing and just stay in general good health, don't get fat, don't eat a bunch of sugar, don't keep your body moving, keep your body moving. That's so important to keep moving. You do just basic things like that. This will last 6 to 10 years if you do nothing. With maintenance, it's indefinite. I have patients in their 80s that are having sex 4 days a week and doing great. I have patients I treated 7 years ago doing great, have done nothing. They're in great shape. So it's really, we will rebuild it. And people say, well, how come it's for a whole year? Well, it's like going to the gym. When you see your body start to change, that's not the time to quit. That's the time to dig in and keep going and solidify the work you've done. And so that's what we do. And what we have found is if we can complete a year worth of treatments, unlimited shockwave, unlimited laser, all your hormones are included, the TRF's included, there's nothing else to buy, everything's included. We pretty much are done. You're done and you're set and ready to go for a long, long time.
Man, that's
So
awesome.
how does that year look like for a patient? Like, are they coming in for different steps, once every couple of weeks, or are you coming in to get like all four steps, one day, and then you're coming back in like a month?
So the hormones are done 3 to 4 times a year, depending on how bad what you need. We believe in bioidentical pelleting is how we do it, and we have our own protocol of pelleting people to where we never let you get below 600 testosterone level ever again. We don't want you to go back to the baseline. You'll be somewhere between 600 and 700, get repelleted again. And that's used for men, it's about 3 times a year. Some guys that are very active metabolize it a little faster, so they're 4 times a year. Either way, it's all included. But when you come in day one, we're gonna draw your blood on day one, and we're gonna do shockwave and heat source, and then one of those two things, or both of those things, and then 1 week later, you're gonna come back again, and we're gonna do your pellets. We're gonna do shockwave, the heat source, and you're gonna get your stem cell replacement shot, the TRF shot, which we have trademarked called the He shot. Then 1 week after that, you come back in for shockwave and heat. And then after your third treatment, it's every other week until we've got about 6 or 8, about 8 treatments on average. And then once we've done the eighth treatment, most of the time we hear, man, things are really working well. And if that's the case, then we say, okay, take 4 weeks off, no treatments for the next 4 weeks, let everything recover, regenerate, heal up, come back, and then we do it again every other week. If they say, I'm getting maybe a little bit of an erection, but nothing, I can't penetrate with it. We'll put them on what's called an advanced protocol, where they have to come every week for 6 weeks. And I like to liken that to boot camp. I mean, we really put it to them hard and heavy at that point. 99% of the time after that, they come in and they're like, okay, things are really starting to work good now. Then we put them on a 4 week break. They come back every other week after that. Usually every 8 treatments, they get 4 weeks off. So on average, you're going to get roughly 24 to 30 treatments a year, somewhere in that. And by doing that, you're going to be pretty stable.
Yeah, that's pretty interesting. Being pharmacists, we always talk about adherence, right? I mean, that's a common thing. How adherent would you say guys are to these treatments? I know that you probably pay for it up front, so you got some skin in the game. But do you ever get anybody that's like, I'm doing pretty good, and then they just kind of,
Unfortunately, yeah, you know as well as I do. I mean, there are some people that just are not compliant at all. And I've had a handful of guys, 3, 4 months in, they're like, man, I'm working great. I'm just not going to go back anymore. And they just disappear. The problem with that is, I would say probably 75% of those guys have called back 6 months later. I'm having trouble again. Well, you didn't finish. And now we got to start over.
right?
It builds on itself. You've got to finish the race. Um, and so we'll work with them best we can, but I'm not going to just start over for nothing either. They got to finish the race. For the most part, though, most men, and I'm gonna say in the high 90 percentile range, get in and they got skin in the game. They're fixed. They're gonna finish. They're gonna do what they're told. It's not cheap by any way, shape, or form, and it's most of the time. If somebody needs a little help, we'll carry you for 2 or 3 payments, but we're not going to carry it for the year. So they're pretty much all paid for it, and we don't have any problems with people just walking out. If they do, they're quick to say, "Hey, I need help here. I'm sorry, I shouldn't have done that."
Yeah, that's fair enough. I mean, we see it just adherence is a big thing, across the board in any type of healthcare medical system to get somebody to commit to a series of treatments or even their own health and wellness, going to the gym, eating right, you know what I mean? Like adherence and commitment can be really tough, especially with all the distractions that we have and especially in kind of the society that we're in where things are, instant gratification. So if Jeff can supply some instant gratification, maybe they're out the door. But I'm glad to hear that people do stay adherent. And then, I think guys more than anything to get their hormones optimized, to get their erectile dysfunction treated, that gives them a new lease on life. And what we've noticed with men is that if you can fix their ED, they're,
Yeah, that's no doubt. 100% correct. 100% correct. And what it is, it comes down to, we get those calls every day of people, hey, I want to get my ED fixed. And we kind of pre-qualify them on the phone. Let's talk a little bit about it before you come in for consultation. And there's so many guys out there that just want to get just a quick fix. I just want to have a good weekend this weekend. Well, in the meantime, we could give you a Band-Aid, but in the meantime, your main problem is just continuing to get worse. Those pills are fine. They're not going to hurt you, but at the same time, you're just masking the problem. And that degeneration of the sponge is happening. Even though you're working and having a great weekend, right? This weekend, took a bunch of Cialis, you're great. It's still degenerating.
When people come in and they want the quick fix, right? And you have to tell them, hey, it's not that easy. And let's say they sign up for your protocol. Do you notice that when they're signed up for the protocol, that not only are you fixing their ED, but are they more determined on the other end to just overall get healthier? I mean, a lot of
Yes,
times, right? Like
yes,
they're more determined to eat right, more determined to go to the gym because it's just going to make the results better. I mean, I don't, we just met a little bit ago. I can tell this is a pretty cool modality, but it would seem like it's motivating to,
very.
spend. Yeah, tell me a little bit about that.
Yeah, you know, sexual wellness isn't a treatment. It's not shockwave. It's not laser. It's not a P shot. Those are all treat parts and segments of ED. You have to treat the whole encompassing problem. And part of that encompassing problem is your general health and well-being. It's amazing to me how many men over 50 sit on their butt and don't do a damn thing. I mean, they just don't move. And they give you the excuse, oh, I was active all these years. Okay, you has been. And then what will happen is your body will begin to shut down. And that's exactly what's going on. So when they start to see things happening, every time they come in for an appointment anyway, we're pushing them and talking to them about their general diet and what they're eating and not eating. And did you get your steps in? If it starts out with that, give me 10,000 steps, a day. And then did you get your steps in? Then it's, did you get your miles in? Then it's, did you hit the gym this week? And most of the guys take it seriously and they really change their lives. It's been really fun to watch. We've got a patient, ex-NFL guy, big dude. I mean, he's just a wall of man. Um, and actually, since he's been coming around for 2 years now, he on a maintenance program, he's come back. He's lost 60 pounds of pure fat. He's still huge, not fat though. He's just a big muscular guy. But he just kind of got it in his head. I'm retired. I don't really need to do all that stuff anymore. And it's like, no, you don't need to do all that stuff anymore, but you do need to work out and keep your body moving. A body in motion stays in motion. So he got a hold of that, and man, he's 48 years old, but he looks like he could probably go start today. I mean, he looks great. He looks really good, and he feels great. And he tells me all the time, he goes, "Man, I feel like I did back in my day." So, and he's working, and all systems are go, and everything's fine.
Oh yeah, that's a big aspect. A lot of people kind of back burner when they think about their health, especially when they start to have some kind of sexual health concerns. Is like that mental health, that how you see yourself is kind of a big factor in how people end up not moving anymore. As you mentioned, kind of with the previous example where the guy's like, "Oh, I used to move all the time, but now I don't need to." You kind of get that in your head, and then you start compounding it with the ED problems, and then your self worth, your value kind of you feels like it kind of goes down, and then they don't want to do anything else. So once they start getting treatment and they start getting results, they're now showing back again. They're like, "Wow, I'm out here like slaying it down. Maybe I can go out and get the 10,000 steps in today. Then next I'll walk the quarter mile that's at the mall layout or whatever it is they got in their area." Um, do you guys? So we know it's a modality for direct treatment. Do you guys discuss or implement, or maybe have anybody else that you recommend patients to go see for like any mental health services or any kind of?
Absolutely.
Okay.
Absolutely. We have two sex therapists that we have vetted inside and out, and we refer to them every week. We refer somebody over there. And then once we got the patent issued, and we put a licensing program together, so you don't have to just come to Colleyville, Texas to get treated. We license physicians all over the United States, and we've only been rolling that out for about 7, 8 months now, the licensing program. But it's really going strong. People are doing really well, and we've literally got doctors in Hawaii and Omaha, Nebraska, and Florida, and New York. I mean, and it's great. And so people are able to get treatment all around the country today. And if my dream comes true, I'm hoping to have licensed providers in every city, in every state in the union, because ED is not going away. And what happens, it messes with your mind so much, and it's an emotional bag of rocks that you're carrying, and you feel less than a man. I can't tell you how horrible I felt at 40 years old. I mean, I really felt like I'm done. I'm 40 and my mind wants to have sex, but my body's saying no, and this is not okay. Um, what really, I remember asking myself, well, what good are you? I mean, you can't even have sex. And it really messes with a guy. You take a man's penis away from him, it creates a problem.
Oh yeah, we are we're big men's health guys. We know it. So,
Oh,
and we've had testimonials and people reaching out about ED and stuff, and it's a great opportunity to have you on. There's another modality out there for guys, and it seems very comprehensive, and we appreciate that because what we've learned. We've been doing this podcast for 5 years, and we've learned that it isn't just physical, it isn't just mental. There is a whole person that
That's right.
needs to be treated. I mean, I can't tell you how many times, just even in our pharmacy career, somebody goes into the cardiologist office, for example, and they say, "Yeah, I go in here. I feel like I'm a heart sitting on a table."
Yeah.
yeah.
Not the, "Hey, what got you here? Why are you here?" Right? But that is just like how men feel, and I think that's why a lot of guys feel rejected by the healthcare system.
Completely. And, I had a phone call this morning. We're seeing them younger, by the way, guys. It's getting bad. I had a phone call this morning from a 29-year-old, was a Division I athlete, played professional sports, and is having ED issues. And he said, I heard you on a podcast. I need to know more information. I need to know what I need to do for me. 29 years old. His testosterone level was 350. That's very low. And he's 29, and he hasn't done anything really bad. There's a lot of problems with the foods we're eating today. There's a lot of problems with the culture. Um, this whole gender identity crisis that America seems to be arguing over, which is totally ridiculous to me. But you know what I really think it is? It's not so much of a gender identity than it is a hormone crisis. I'm meeting so many young men that have testosterone levels of women. They've dropped, they've lost so much at such young ages that they're not sure what in the world they are. And so, you get that in high school and you've got low levels, whether it be genetics, whether it be diet, whether it be chemicals, whatever. Um, sure, you're going to question what you are and who you are. You're estrogen dominant. Now you're an emotional basket case. You're not testosterone dominant like you should be. So all your body's faculties begin to break down when your hormones are out of balance. And I see it every day, and they're getting younger and younger. When I first started this, it was 55 to 75, hands down. That was my demographic. I literally have patients. My youngest that we're actively treating is 32, um, and my oldest is 85. So it's really all over the board, and people just it's happening more and more and more. And I don't, like I said, I'm determined to get one in every city and every state because this is a problem. And we work. 97.2% of the time we work. If we don't work, it's because there's some other major health issues that are preventing you from recovery, and from your body regenerating its stuff at the cellular level.
For sure. So last question really quick. how much do you address when it comes to porn consumption? That is a big deal with guys. That is, something that we are very passionate about, is about really like freeing men from porn. It ruins
Yes.
the dopamine pathways. It's ruining neurotransmitter pathways. It's making men desensitized to the actual sexual experience. I mean, is this something that you're addressing out front, asking how much porn they're consuming?
100%. And a lot of these younger guys, that is the problem. I will tell you, working with these sex therapists and psychologists, and I've got a world-renowned sexual psychologist, psychiatrist that is on our board, and working with him, talking with him. Porn addiction is getting worse, obviously, because everybody's carrying a worldwide library around in their pocket. To access free porn whenever they want now on using their phone. And everything you just said is 100% right. Dopamine desensitizes, fantasy world, all that stuff. It makes you live it makes your opinion and your perspective of sex something that is just not real. And then you get into the realistic world and you go, well, it's not as good as it was in that movie, so it must be me. Takes more and more to trigger you, to stimulate you, to get your body to get you erect and things like that. I'm being told by these doctors that that's the easiest to fix. And you go 90 to 120 days with no porn, and your mind will reset. Your mind will reset. But yet, getting people to go that long, it blows my mind. It blows my mind. I say, you don't need it. You just don't need it.
Yeah, you can just be like, hey, come to RegenMax, get a
Yeah,
raging dick, and you don't need porn anymore.
don't need it anymore. Get turned on by your woman,
There you
whatever.
go.
You must the 90 days.
Yeah, that's how it
Love it.
works.
Jeff, is there anything that we didn't cover that you would like to discuss?
I would just like to throw it out there. And if you're a physician or a medical provider and want to discuss it, we would love to discuss getting a license in your hands. You can go to regenmax.com, RegenMax, regenmax.com. Um, well, there's providers there for providers and for patients there, or you can always go to swcofusa.com, and that is our clinic's website. But we're just here to get people right. For me, it literally was a suicidal moment in my life. I'm way past that now. But that's what drove me to fix all this stuff. And every time I meet a patient in my office that walks in brand new, I can see the despair in their face. I just tell them, hey, this too shall pass. We'll be all right. We will get to the other side of this and you'll be fine. So I appreciate you guys having me on. This is great. Any chance I get to publicly talk about this and get the word out makes me happy. So thank you for allowing me to be on here. And anything I can do, give my number out, give my websites out. We'll be happy to talk to anybody.
Yeah, we'll post all of that info in the description, guys, so you can go and you can find Jeff in his clinic and learn a little bit more about RegenMax. I think this has been a great episode where we talked about, we don't just talk about the ED, we talk about the holistic man. So I think it's great that you're attacking, health and wellness and sexual health from a holistic perspective. And you're welcome on the podcast anytime, Jeff. We've had a lot of fun.
Well, I appreciate it. Thank you so much, guys.
Thank you.